Welcome to this video on reproductive health data, a 2026 needs assessment from Youth Empowerment Services. This data covers teen birth rates, sexually transmitted infections, and young people's behaviors and attitudes. This video will cover the following contents: teen birth rates, sexually transmitted infections, HIV diagnoses, youth risk behavior surveillance data, and yes, entry survey data from fall 2025. We begin with teen birth rates among females aged 15 to 19 years in Connecticut and in New Britain, with data sourced from CTDPH registration reports. Teen birth rates have declined for all racial and ethnic groups in Connecticut. However, significant ethnic and racial disparities persist. Latina and Black females consistently have higher teen birth rates than their white counterparts. The same towns, including New Britain, consistently rank highest in CT for the rate of teen birth among female residents ages 15 to 19. Next, we examine chlamydia and gonorrhea. We look at traits and counts of cases in Connecticut and New Britain, focusing on youth aged 15 to 24 years. The CT rate of chlamydia has been consistently lower than the US rate for youth aged 15 to 24 years. In 2023, youth ages 15 to 24 accounted for 59% of chlamydia cases in court. In 2021, New Britain ranked 5th in the state for chlamydia cases among youth aged 15 to 24 years. Chlamydia rates were higher for females than males in CT from 2012 to 2023. Females accounted for more than 7 in 10 cases among youth in New Britain between 2019 and 2021. Similar to chlamydia, the CT rate of gonorrhea has been consistently lower than the US rate for youth aged 15 to 24 years. Youth ages 15 to 24 years accounted for 40% of gonorrhea cases in CT in 2023. New Britain ranked 5th in CT in 2021 on the count of gonorrhea cases among this age group. Gonorrhea rates were also higher for CT females than for CT males aged 15 to 24 from 2012 to 2023. Females accounted for more than 6 in 10 cases of gonorrhea in New Britain. We now move to HIV diagnoses. This section reviews rates and counts among adults and youth aged 13 to 24 years in Connecticut and New Britain. HIV diagnoses have declined for all major racial and ethnic groups residing in Connecticut. Racial and ethnic disparities in HIV diagnoses persist in Connecticut. The distribution of diagnoses by race and ethnicity varies between CT overall and New Britain specifically. Among CT youth aged 13 to 24, HIV diagnosis counts decreased from 2008 to 2022, then increased in 2023-2024, reaching 49 diagnoses in 2024. HIV prevalence among CT youth aged 13 to 24, meaning those living with HIV, has decreased over time, from 313 in 2008 to 164 in 2023. We now examine YRBS data. These are high school students' responses to the CDC's Youth Risk Behavior Surveillance System survey in 2023. In 2023, fewer than half of CT high school seniors reported they had ever had sex. About 1/3 reported they were currently sexually active. The percentage of high school students who reported having ever had sex and those currently sexually active has been on a decline both in CT and nationally since 2011. We look at data from the Youth Risk Behavior Surveillance System regarding the use of birth control and condoms at last sexual encounter. Next, we review the Youth Empowerment Services, or YES, data. This includes high school students' responses to the YES entry survey in the fall of 2025. This graph illustrates the percentage of high school students in New Britain who reported they had ever had sex or were currently sexually active, broken down by grade. Here is the percentage of high school students who reported they had ever had sex or were currently sexually active, broken down by gender. Students wanted to learn more about a variety of topics, including sexually transmitted infections, birth control, healthy relationships, and sexual orientation. Students identified clinics they would go to for STI or pregnancy testing. They checked off an average of 3 clinics in New Britain or nearby towns. Thank you for watching this video on reproductive health data.